Usec, in terms of our capacities at the hospitals, I remember months back when people were concerned about hospital utilization and they were also concerned about oxygen supply. I remember it was either you or Usec Vergere that said na hindi, pagka may nakikita kayong nag-aagawan sa oxygen, that's probably people wanting oxygen in their private homes. And there was also a moment of education for us where somebody told us, no, actually, madali lang gumawa ng oxygen. Even hospitals in Metro Manila have facilities for that. But now that people are seeing these familiar scenes again in Cebu of people wanting to get their hands on oxygen, maybe you could just contextualize for us what people might be seeing or might be misconstruing about the oxygen situation in Cebu and in the country.
Okay, Robbie, in terms of the oxygen, I think we have tasked the Department of Trade and Industry to look into the output of the oxygen supply. And the oxygen suppliers here in Luzon, Mindanao, and Visayas, they have a total capacity of, on an average daily use right now, 205 tons per day. And this is what that was the output that they had during our surge last April. But their maximum output is they can actually do 600 tons per day. So in other words, there's still a big surplus in terms of the tons, the number of oxygen tons per day that they can actually produce. In terms of the hospitals having oxygen plants, it's very true. Most of the big hospitals, especially with the government-retained hospitals, they do have oxygen plants, meaning to say that they can actually generate oxygen and pass this oxygen to pipelines towards the different wards and to the different intensive care units. You don't need a cylinder there. You just actually make sure that you are able to do this built-in kind of piping for this oxygen to the different wards and intensive care units. So we do have this kind of hospitals here in Manila, in Visayas and Luzon. I think there are about 21 of these hospitals that have the capacity really of producing their own oxygens. And some of the oxygen tanks that you've seen in Cebu also meant that the emergency room at that time, because that was really a snapshot of a certain day, and the emergency room really at that time was full. And you know when you are in an emergency room, people you need to be assessed whether you are COVID positive or negative, and it will take time. Even if you do a gene expert RT-PCR, it will take about a minimum of 8 hours. So this is the reason sometimes that you have a queue in the hospitals because they don't know where to bring you, whether to a negative COVID ward or the positive COVID ward. So it's very important that they actually do the testing in for all the suspects and probable in the emergency room. And this is really what happens when you have an increase in the new number of cases and active new cases, especially when all of them will really go to the hospital and look for support and services.